So how is skin of colour different from other skin types, Sanam?
So there are actually really good benefits of having our type of skin or skin of colour. We have delayed signs of aging because we have a higher melanin content which protects our cells from aging, and we also have more robust skin, so we've got a more compact, what we call stratum corneum. We produce more collagen because we have more fibroblasts, and hence we have less fine lines and wrinkles. Did you know, on average, research has actually shown that skin of colour looks 10 to 20 years younger than other skin types? We also have a higher melanin content, and our melanocytes are the same, but they play very different roles and protect us against UV radiation, which kind of helps us with all of those above. However, there are some disadvantages, Govinda. Can you tell us a bit about them?
Yeah, absolutely. And I think you've touched on a few really, really important benefits, but there are some definite drawbacks with having melanin-rich skin. And the first thing that really comes to mind is the fact that we tend to hyperpigment as well as hypopigment, so more pigmentation or less pigmentation. We significantly have a large proportion of people from skin of colour that have pigmentation disorders. We also have lower concentrations of ceramides, which is a complex lipid fat structure, and they really just help to keep the skin nourished and hydrated. And having that lower amount means that we're more susceptible to having dry skin. Another drawback, Sanam, is the fact that we also have oily skin, and I know a lot of our family members and community members can relate to this, and that's because we have a higher amount of sebum production from these oily glands, and that leads to acne. That's a massive problem for skin of colour because our skin is so sensitive. When you do create that inflammation, you can also then trigger hyperpigmentation, which is that post-inflammatory hyperpigmentation response. So we talked about increased inflammation already, but it's also an increase in skin sensitivity. Our skin is much more prone to conditions like eczema and damage from chemical irritants. So because we have this increased inflammatory response in our skin, we also have much more sensitive skin, and that makes us prone to conditions like eczema and from chemical irritants as well. We're also more prone to keloid scarring, which is basically an exaggerated healing response from any kind of trauma.
So what are those keloid scars? What do they look like?
They're the thickened scars that go beyond the extent of where the wound is.
Particularly on the chest?